Speed on board, healthcare onboarding accelerated. Hi, welcome to the last video in the emergency department. This is the wrap up, the outro. So let's take a look at what we covered with the 5 vectors as we went through the emergency department. Number 1 was survival of the patient. We talked about the tracking board and how there's a row for every patient, and that says what needs to be done, where the results are, sort of is the air traffic controller of where that patient is on their journey through the emergency department. Number 2 was survival of the facility, the revenue cycle piece. And since the emergency department is the doorway to the inpatients, and the inpatients generate the revenue for the hospital, one of the most important survival of facility functions of the emergency department is to get patients in the door and funneled upstairs into beds. Third vector is operations. So from an operations standpoint, we talked about throughput, moving those patients through the system. We have measures from the time they arrive. We have a measure from the time they're admitted until they go upstairs or depart the hospital. So we've got throughput measurements, and that's what operations is most concerned with. In terms of quality, we looked at 3 outcome timings: a door-to-needle, door-to-balloon, and door-to-scan. Each of those were different metrics for different disease states somebody came into the hospital from, and their specific timings. In order to have quality care outcomes, we need to hit those timings. So that's what's tracked from a quality standpoint. And lastly, we covered the interoperability vector and looked at the flow of orders out and results back. We're going to get them to the scan. We're going to get them flown through throughput-wise out of the department. We need to get those orders out and the results back so we can make decisions, treatment decisions. So now we've covered the first department. We've covered the first 5 vectors. How's that inner cheetah of yours? So we're taking all of the important things going on in EDs across the country and showing them to you here. So what's left to do from this module? Well, you need to read the 2 articles, and then you'll take the quiz. Quizzes will come, and you'll be able to test your knowledge and help drive what you've been learning in for long-term memory. And then lastly, remember, you're going to go out and visit the department, so you need to schedule that meeting. With the learning you have and with all the vectors and what's going on, you're now prepared to go out and talk to those people in the emergency department. After that, you're done with the emergency department, and it's move on to department number 2, and that's patient access. That'll be fun. I look forward to that. And again, thank you for watching.